Welcome to Boom Goddess Radio. I'm Jennifer Davis Page, your host, and today we are continuing a wonderful conversation on summer hearing, and with our expert, Dr. Cristi Moore from Sonora Hearing Care here in Tucson, Arizona. Welcome back, ladies. Today we are doing part 2 of this wonderful conversation, and our guests include Darrell and Susan and Maria, who have some wonderful questions for Dr. Cristi about hearing and hearing aids and just about everything. So now, welcome back, ladies. Who wants to start on part 2? Maria, did you want to talk about specifically about your parents, and let's introduce them to our listeners that perhaps have not tuned into last week's show.
Right. So, Doctor, my parents are both 90, and they both do have hearing aids. And of course, right now, I have not been able to get them to use their hearing aids on a regular basis. Mom definitely does not like them. I think it took her off guard because, you know, she was probably able to hear too much and she didn't like the noise.
Right.
Dad is a little bit more receptive to using them. So basically tips on how to try and convince them to keep wearing them.
Absolutely. So that's a great question, and is a challenge, especially when people may have had hearing loss for many, many years or decades, and then get hearing aids, and then at that point they've gotten used to not hearing well or compensating for that. And then when you give a hearing aid and all of a sudden now we're bringing in some sound that they haven't heard and saying, okay, this is what it's going to sound like now. And it's what they've been used to hearing, or it's not what they're used to hearing, but it's what they should be hearing. Mm-hmm. And that makes it hard to really accommodate that. And everyone's a little bit different on how they're going to be receptive to certain sounds. It can be a progress. Sometimes it has to be a very individualized progress. Sometimes you have to take it slow and just say, okay, you know, the audiologist or hearing instrument specialist may have to program them with a little less volume than what would normally be required to let them kind of build up, get used to it over time, sometimes weeks or months. And then the wear time sometimes has to increase as well. Sometimes wearing them full time from the start is a little overwhelming for some people. So sometimes backing off and saying, okay, we're going to wear them, you know, 3 or 4 hours today, and we're going to do that for several days. And then maybe next week, we're going to start increasing the wear time, adding an hour, and then adding this, and, you know, making sure that if they have a volume control, that they're comfortable doing that so that they have control over how much sound is doing that. Helping them with some techniques, getting them to listen to speech, whether it's your spoken voice, whether it's watching television with the captions, whether it is doing some audiobooks and listening to that and reading the book along with that. There's also some great websites that have some wonderful speech reading exercises that can help you with that too. So there's a lot of things that can help, but ultimately it's an individualized situation. And sometimes it just takes a little bit slower progress for some people to get comfortable and used to that. Their brains will adapt, but sometimes it can take a little bit longer time to do that.
Right.
I remember you telling me at one point that it's sort of like if I buy a piece of software and I put it in my computer, but I don't program that software correctly, I'm still not going to be able to use it to the way it should be.
Yeah.
So one of the big things with hearing aids is, and my mother had this, they bought it over the counter because, you know, it was a money issue, and it was always buzzing and chirping and beeping, and ending up that it wasn't the hearing aid, it was that the hearing aid hadn't been programmed correctly,
right,
for her level of hearing loss. And once we got that resolved, then the chirping, buzzing, and all that stopped, and she was much more willing to wear the hearing aid. So I say not only Maria, because mom kept complaining, it's chirping again, it's chirping again. Right. Well, then we go get it reprogrammed, and it was in the programming. So
exactly. That's right.
We found that helpful with my mom, Maria.
Exactly. And sometimes the hearing aid can be programmed and fit appropriately, and everything is done right, but the brain still has to make sense of that information that it's picking up from that device. And that is a rehabilitation process similar to going through any kind of rehab after you have, like, say, a knee surgery or a hip replacement, or anything where you're having to relearn a skill that you used to do just fine, that now has to be done a little differently. So the information, the brain has to be able to know what to do with all of that sound information that's coming in from that device. Absolutely.
Right.
I have a question, Dr. Cristi, unless Maria has another follow-up.
No, go ahead, please.
You know, there's a stigma that some people who, as they get older, have about hearing aids.
Yes.
It's a sign that you're getting older. I don't think the same stigma exists for readers.
Right. That's right. It doesn't.
And so many people, and I find this true of myself and others, we really are not really hearing very well.
Right.
And, you know, we're kind of like putting it off because it's like, oh my goodness, if I get a hearing aid, I'm really old. So
Right.
I'm wondering,
Right.
you know, because it really is beneficial to be able to hear. And,
Yes.
you know, sometimes it's just best that you know what you need and you go and get it. And then there's this cost that everybody is worried about. So they put it off. So you've got
Right.
to balance oh, I'm getting to the point I can't hear. I might need it, but it means I'm going to be old. And then, but can I afford it? So
Yeah.
how do we balance that when we're in this season of life?
Yeah, that's a great question. So, you know, I always say that, you know, hearing loss is not a sign of getting old. It's a sign that you've had a pretty good life, because that means you've really done a lot of great things. Yeah, exactly. You know, yeah, you've enjoyed life. You've been to concerts, you've been to, you know, movies, you've been places, and your ears get a workout. And just like with anything, you know, they kind of wear out. So they don't work as well as they did when we were younger. So, you know, now, you know, hearing loss is not something that is only seen in older people. It is more common because as we age, our ears don't pick up the sounds as well as they used to, but a lot of our parts in our body don't work as well as when we get older as when we were younger too. So that's the truth with a lot of things. But hearing loss can be at any age, of course. So I think now that we have more things that are in our ears, you know, more like I've got my AirPods in, okay, and people have other Bluetooth devices, or they have other types of headphones or earphones. It's not uncommon to see people of all ages wearing something in their ears. And hearing aids are no different. Sometimes you don't know, is that a hearing aid or is that like an AirPod? And could it be either? Could it be both? Mm-hmm. Hearing aids can stream just like a lot of AirPods as well. You can listen to music, you can do telephone calls, all that kind of fun stuff too. So they really can enhance that. But the most important thing to consider is that hearing health is so important to your overall health. It's important to your cognition. It's important to your balance. It's important to your heart health. It's important to all aspects of your body. So when you don't hear well, you're missing out on so many things of your life that it really is important. Just like getting a vision check, you need to get a hearing check as well to do that. And it's a priority. You know, unfortunately, there are things that sometimes insurance doesn't cover. So there are some money that maybe has to be set aside for those expenses. You know, we all may set aside money for certain things, or we prioritize certain things. And hearing health is one of those things that sometimes we may have to say, well, insurance isn't going to cover it for whatever reasons. So this is something that, because I want to keep on having an active lifestyle and being a part of my community, this is something that I'm going to say, yeah, I've got to go ahead and do this for what's best for my health. Yeah.
Because we didn't have, when we were all teenagers, we didn't have any earbuds. We didn't have any of that. You put your record on the record player and you listen.
Yep.
Okay? And your mother
told you
to turn it down because it was too loud.
Right.
Do we have an advantage over our grandchildren who are always plugged into something? Do we have an ear? Tell us that we have an ear advantage, a hearing advantage.
Maybe. It all depends on how loud you had that music. Because if you were sitting really close to a record player and you had it blasting and that sound was at a certain decibel level and you were really close to it, you can do hearing damage. If you went to a concert and that concert was really loud and you were right up close to the band at the stage, that can do hearing damage. If you have an earbud or something in your ears and you have it turned up too high, yes, you can definitely do hearing damage as well. But you can also take that volume down a little bit lower too and not do as much hearing damage. You can be further away from a concert and not have as much hearing damage. You can wear earplugs. So I would say, unfortunately, it may be a wash on that.
What do you tell grandparents and parents who are dealing with their children or grandchildren about being careful about how loud you have it? Because sometimes I've seen kids and and when I pass them, I can still hear the music. So that's right. Blowing their head off.
That's right. That's a sign it's probably too loud.
What do you tell parents what do you say to them when and I know those are questions they've asked you.
Absolutely. So I tell parents that even if your child says they're listening at a comfortable volume, make them turn it down just a little bit more. I do that with my own son. So he knows better. But it's also wear time too. It's the amount of time too that you're exposed to certain levels of sound that can be damaging over time as well. So giving your ears a break is really important too.
I don't think people ever give their ears a break.
Right. No, they don't. We don't get to turn our physical ears off. You're right. No. But we can limit the amount of loud sound that we're exposed to on a day-to-day basis. Yeah.
We have a couple of minutes left on this segment, and I'm hoping that we have enough time to talk about. Susan was talking about the fire engines and the police sirens, and let's talk a little bit about that.
So those sounds obviously can be very, very loud. And as Susan was doing some research on, the fact that these sounds can be louder than what is recommended for our ears. So that can be something that if we're exposed to that for periods of time, that can be very damaging to our ears, especially if we're in close proximity. Now, when we're driving and we hear a siren in a distance, that siren is loud, but we're further away from it. So the impact is not going to be as great. But if you're right next to that fire engine and the siren goes off, that could definitely be loud enough to damage your hearing, especially with a short amount of time. Absolutely. So a lot of it is volume and a lot of it is time that you're exposed to as well that can do damage.
Don't buy a house next to the fire station.
Right. Or have really good insulation and really good sound blocking windows.
Then you'll miss all those beautiful bodies coming out of the fire station.
Hearing sounds in their home. Some people turn it up high, other people like it turned down low. What do you do?
As far as are you talking about television or something like that? Yeah. So, that's going to be a battle no matter what. You've got to come to a compromise and find out what's a good, comfortable level that both of you can rely on. Throw the closed caption on if you have to.
Yeah.
And get your hearing checked.
Yeah.
Might see you one day soon.
Yeah.
I'll say again, Darrell, I didn't hear you.
I said she might see me one day real soon.
Absolutely.
Well, I hope she does. Ladies, we're going to take a break. And to our listeners, please stay with us for some more valuable conversation with Dr. Cristi Moore.
Don't wait. Communicate. Make your emergency plan today.
Welcome back to Boom Goddess Radio. This is Jennifer Davis Page, your host, and today we are having a wonderful conversation about our hearing. And we're with a brilliant audiologist, Dr. Cristi Moore, who owns Sonora Hearing Care here in Tucson, Arizona. And welcome back to all the Boom Goddess listeners. Maria, you had a question for Dr. Cristi?
Yes, I was wondering, what information do you have for us regarding our rate of speed, how we process when we get older, what we're hearing?
Absolutely. So one of the things that I always talk to patients and their loved ones about is that louder isn't always where the problem is. Louder isn't always going to make them hear better, but slowing your rate of speech really does help with processing. And there's been some interesting studies done on how we process speech from when we're younger in our 20s and 30s to when we get older, even in our 40s, 50s, 60s, and beyond. And when we're in our 20s or 30s, we can multitask a lot better. So we can listen to fast speech. We can be doing something on the computer. We can be helping someone that's in front of us. We can do a lot of things and do it quite well. And that's part of our brain's ability to just, look at what's going on here, all of that. We can understand speech much faster, 160, 170 words a minute, no problem. When we get older, our rate of speech understanding, our ability to process slows down. So even when we get into our 40s and 50s, that rate of speech might start to slow down to 150, 140 words a minute. And then as we get into our 60s, 70s, 80s, 90s, that rate of speech may slow down to 120 words a minute. So the average speaker right now speaks at about 170 words a minute, okay? So that is fast. And when you're young, you can process it pretty well because your brain can absorb all of that and figure out where to code all that information. So when you're dealing with someone who is much older and our rate and our ability to process speech slows down anyway, and you've got someone speaking at 170 words a minute and you can only process 140 or 50 or 120, no wonder people are having difficulty where they say, I'm not understanding what you said. It just went all by in a blur. It really did. You add hearing loss to the mix, and that makes it even harder because your brain's already trying to compensate what that sound was. And now someone's speaking really quickly. It just makes no sense of it. So when we can slow down our speech, when we can give good facial cues, that's going to help us in general, whether we have hearing loss or not. It's just going to help facilitate good communication all the way around.
Great, it's awesome.
I was reading my owner's manual for my car, and it says every 60,000 miles you ought to have this done, every 100,000 miles you ought to have that done. Since we don't have a manual like that for our bodies, tell us, how often should we have our hearing checked? I mean, how often should our hearing be evaluated?
Absolutely. I always say, your hearing should be tested very similarly to getting eye exams, really. So if you haven't had a hearing test done in your adult life, you should at least go have one when you reach the age of 50, if not sooner than that. And then from there, maybe every 1 to 2 years, have an annual hearing test, depending on what the results are. And that way, if hearing loss does start to develop, we as audiologists can catch it sooner. We can have a conversation and say, okay, now you're starting to have some difficulty. Here's how this hearing decrease is affecting you. And here's what could be happening. And here's what could, might happen down the road. Maybe you're doing fine right now, but you're using a lot more resources to do as fine. So you may be getting more tired, more fatigued. Whereas if we start talking about a hearing solution, which could be an over-the-counter amplifier, could be prescription hearing aids, could be an assistive device, could be something more than that. We're going to say this is why these treatments are going to help facilitate better communication and help keep your brain understanding so that when you are older and you do have more hearing loss and you are having more trouble, you're already going to be ahead of the game. You're going to do that much better than if you wait until it's bad enough to do something about it.
Is hearing aids the only solution to fixing the hearing problem? Can it be something as simple as taking an aspirin every 4 hours? I mean,
not quite that simple.
okay.
But hearing aids aren't always the only solution. They don't have to be the only solution. They are one of the most used solutions because of the type of hearing loss that most people have. Most people have a type of sensory neural hearing loss, which is most effectively treated with hearing aids or amplifiers. But some surgical remedies can improve a person's hearing. There are also implantable devices that can improve a person's hearing ability, such as a cochlear implant or a bone ossegrated hearing device, as well as surgically repairing part of the hearing system that doesn't work, that is a mechanical issue. So there are things that can affect it that way as well. So there are other solutions besides hearing aids, but they are one of the most recommended because of what they can do and how they facilitate communication.
Let's talk a little bit before we end our show. I'd like our listeners to be able to understand how insurance can help them purchase or hearing aids, because they are very expensive. And we talked in the first part one of this amazing show about over-the-counter hearing aids that President Biden has just signed a bill so that we'll be able to go to the drugstore and run our local druggist crazy, asking him a million questions, him or her a million questions that they don't have answers to yet. So let's talk a little bit about Medicare, Medicaid, and other sources that can help with paying for these items.
Absolutely. So right now, the way that the legislation is written, Medicare and most Medicaid plans for adults are not going to cover hearing aids. Medicare for sure. Medicaid is state dependent. So again, that's going to depend on the individual state in which you reside. Some Medicaid plans, some states' Medicaid plans may have coverage for hearing aids for adults and children. Again, it just depends on the state. Medicare is our federal universal insurance coverage for older adults 65 and older. Right now, that is something that was never written into their legislation to be a covered benefit. So the hearing testing can be covered with a physician order by an audiologist. So that's a diagnostic service that is covered. But the treatment option, which is using a hearing aid, is not covered by Medicaid. So those are going to be out of pocket unless there's another insurance option. Some commercial insurances may have a benefit that covers the cost of hearing aids or partial cost of the hearing aids, but most insurance plans are not going to have that. So hearing aids are traditionally going to be an out-of-pocket expense. And you're right, not everyone can afford that cost, which is why the over-the-counter bill has been enacted and has been written so that they have some sort of solution coming. But again, there's going to be some pros and cons with that as well, as we kind of discussed in the last episode.
Can you rent a hearing aid?
There are some lease options out there. So there are what we call some subscription-based options. So you would just pay a monthly fee for the use of hearing aids. Yes, some practices, my practice does that, and there are some other practices out there that do that as well. So that's definitely an option. There's financing too, where you can do a financing option similar to like a credit card, where you purchase the devices, but then you just pay it as a monthly installment, for the use of that. There are some programs out there for people that meet certain income requirements. So we have a hearing aid bank that's done through the University of Arizona that works with low-income people to qualify them. We have some other nonprofits here in town as well that, again, work to fill in the gap for sliding base for covering the hearing test at little to no cost and covering hearing aids at little to no cost as well. So there are definitely some options out there for people that may not have the funds to purchase a set of hearing aids. Vocational rehab programs are available too for working adults that may need assistance with providing those devices too.
When we talk about hearing aid, and we talked earlier about the the price differences in some of them. You said earlier that they can be as low as maybe $300 and as expensive as maybe $3,000. Now,
Right.
is that the difference between a Hyundai and a Rolls Royce? Do they operate the same way, but you're just getting, a Rolls Royce rather than a Hyundai?
Yeah. So there's a lot of actual peer-reviewed literature out there to show that treating hearing loss with the use of amplification, when you're looking at how you are amplifying sound with different frequencies where you don't hear, that there may not be a lot of difference between whether you're using something that's more basic or something that's more sophisticated. Okay, you're going to get very similar results on that.
Okay.
There are some features that are available in some of the more advanced or premium level technology that may not be available in some of the more entry-level devices. Some of those things can be how they process speech in certain conditions or whether they stream to other Bluetooth devices or things like that. And then the services. The majority of the cost of hearing aids is not the hearing aid itself, it's the services that go with it. Since those services are not covered by insurance plans, those costs have to be incorporated somehow. So a lot of times we incorporate that into the cost of the hearing aid, or we separate it out and say, this is the cost of the hearing aid. This is the cost of the service plan to have all of these visits for follow-ups and program. That's going to be this fee over here. And so that's where that whole kind of cost comes into place, right?
I see. All right, so just tell me a little bit about services then. I buy a hearing aid. We only have a couple of minutes left, but I want our listeners to be able to understand this.
Right.
Buy a hearing aid, and and the services depend on whether you go from a $300 to a $3,000 one. Now,
Yeah.
what does services mean really?
That's a great question. So basically, we're not just going to put some hearing aids in your ears and send you out the door and say, good luck, come see us when you have a problem. So it requires fitting the devices. So basically, when we are putting them on your ears, we're going to make sure the fit is comfortable, that they're fitting in your ears comfortably, that they're programmed optimally for your hearing loss, and that they're verified, meaning you're getting all of the sounds that you need for your hearing loss. And then we're going to show you how to use them and how to take care of them. And we're going to, say, okay, and here's some literature, here's some resources you can have for how you're going to now do some training exercises to help your brain get used to these sounds. And we want to follow up with you. We want to see you in 2 weeks. How are you doing at that time? Maybe we're going to program them on the computer, make some adjustments. We're going to see you in maybe a month from now, 3 months from now, a year from now, and then everything in between. You have a question about how does this work on my smartphone? How do I clean this device? What happens when this device isn't working? So those are all things that are taking our time that's covered as part of our ability to be there for you when you have that problem. So that's what we talk about when we have those services included as part of the cost of the hearing aid with the services that go with it.
That's excellent information. I'm happy that you were able to explain all that. I only have a minute left. And ladies, I want to thank all of you for participating with Dr. Cristi and I and making this an amazing, very informative program. I want to thank all of our listeners for listening into Boom Goddess Radio. Dr. Cristi, I want to thank you again for being part of the Boom Goddess family and giving our listeners all this very valuable information. And ladies and gentlemen, please continue to listen to Boom Goddess Radio. We'll continue to give you excellent programming. We thank you so very much for joining us, and we'll see you on the radio next week.